2018 Los Angeles City Health Commission meeting. May we please have roll call?
Grimmick, Hisrich, Cotto, Mandel,
Present.
Ozzie, Vic.
Here.
6 members present and a quorum.
Thank you. Next item, approval of the minutes from July 9th, 2018. Any discussion on these minutes?
So moved. Second.
All right. Any opposition of that approval? Any abstentions? Minutes are approved. Anyone here from the neighborhood council that wants to make a comment? Moving on to public comment. Do I have any comments for public comment? I don't see any. Just want to make sure before we move forward. Okay. Moving on to item number 1, presentation and discussion regarding public bathroom access options for persons experiencing homelessness. Pete White, Executive Director, Los Angeles Community Action Network.
Good evening, and thank you guys for having me to talk about this most important issue, the lack of public health infrastructure for houseless people in the city of Los Angeles. I think in my short remarks, I want to talk a little bit. I'm going to talk more about the lack of public restrooms from a Skid Row vantage point, because I think if we look at downtown Los Angeles, it sort of paints a picture from 1987 until right now about a dismal failure on the part of our city to provide adequate public health infrastructure. When we're talking about bathrooms in particular, we would note that Angelenos, rich nor poor, have access, but when we think about it from a human rights framework, you have a duty to ensure those with the least of thee have accommodations, and that doesn't happen. Before I start, I want to indeed shout out individuals sitting behind me from the LA Community Action Network, with whom without none of this participatory action research and these ethnographic studies would be made possible. I'm going to talk tonight about the dirty divide. The dirty divide is our articulation of public health infrastructure that exists west of Main Street in downtown Los Angeles. West of Main Street is where the market rate lofts and condo conversions exist, versus those public health amenities that are woefully inadequate east of Main Street. And so just a little bit of history to get us into it. The history of public health infrastructure, or the lack thereof, for houseless people dates back to 1987. Probably further than that, but when we start really mapping it, it's 1987. Mayors Tom Bradley, Richard Reardon, James Hahn, and Antonio Villaraigosa all largely ignored the health and housing needs of their poorest residents, right? During sort of the James Hahn and Antonio Villaraigosa era, in the 50 square block known as Skid Row, there was the placement during one tenure, James Hahn's tenure as mayor, of 19 porta potties for 11 to 13,000 residents in downtown Los Angeles in that 50 square block known as Skid Row. And there had always been a concern during that era of, do we place more or do we remove the porta potties that exist? It was yet again a temporary fix for a long-term solution. And then we would move forward, and Antonio Villaraigosa would remove all 19 of those portable toilets under the auspices of a public safety concern, right? And so we would have, and we continue to have, this trade-off dictated oftentimes by law enforcement of public safety or public health. We can't have both. Those 19 toilets were removed, and 5 automated toilets were placed in Skid Row for a growing population of 13 to 15,000 people. Now, that's east of Main Street on the Dirty Divide. West of Main Street, we would see public amenities open for new arrivals and well-heeled residents. The restrooms in Pershing Square would be open for white, well-heeled folks and closed for African Americans. Race is a powerful determinant in downtown Los Angeles in terms of who begins to have the ability to access both public health infrastructure like at Pershing Square and other places, as well as private businesses. The other thing that we would note in the Dirty Divide update, both in 2012 and in the update in 2017, that there were more amenities for pets, for dogs, in downtown Los Angeles than there were for human beings. And so we would see patches and squares where dogs can go. I have dogs. I'm a dog lover, but I'm human and I love human beings as well. And we would see bags for dogs, and we would see water fountains for dogs, but we would not see public health infrastructure or toilet infrastructure for poor people. So instead of parks, water, and hand washing stations, poor communities received paddy wagons. Instead of porta potties and supplies, we received additional police and patrol cars. And instead of being treated with dignity and respect, the community was punished for existence in spaces they weren't supposed to be in. So I'm going to move us forward, and I'm going to give you just some of the highlights of the out-of-service update. Our research revealed that in Skid Row, residents are at risk of criminalization for low-level offenses such as public urination, jaywalking, walking in the roadway, and camping. It also revealed that people with less means do not have equitable levels of service. It's something that we're here to talk about tonight, that there is a lack of public restrooms, increasing the risk of communicable diseases. And the few restrooms that exist are poorly maintained, do not have toilet paper, soap or running water, or feminine hygiene products. It's important to note when we talk about the Dirty Divide, the Dirty Divide was rooted in our ethnographic study in 2012 in response to the Public Health Department upon the urging of community residents to come and investigate not just restrooms, but trash collection and vermin and access to water. In their March 2012 report, the Department of Public Health issued the following. They said this: what is most critical in the survey is the continuing lack of access to fully operable and sanitary public restrooms for homeless residents in the Skid Row area. Mind you, this is in 2012. The 2012 survey noted that 2 of the 3 automated public toilets were either unsanitary or dirty without hand wash soap. 75% were inoperable. And re-inspections conducted in May 15th, 2013 revealed the same number were broken, right? It also highlighted a comparison of urine fecal matter locations to the 4 ATP locations revealed that 16% of total deposits occur within a 300-foot radius of the APTs, the automatic public toilets, and the number of deposits increased to 59% at a radius of 600 feet. That was 2012. That was 2012 when the Public Health Department came in and inspected, and not only did they inspect, but they also issued corrective actions to the city of Los Angeles, right? They would say at that time that there needs to be an increase, right, of public health infrastructure, toilets, right, every 300 square feet, every 300 radius, excuse me. There needs to be an additional APT or restroom facility located, right? They would then warn, which becomes interesting, in 2012, the Department of Public Health would warn the city of Los Angeles that if they, in fact, did not increase the volume and the number, there's a big old fly, I'm talking about restrooms and the flies are coming. They said that they would, the community would be at risk of communicable diseases, and then they would list hepatitis in 2012. And then in 2017, what happens? A hepatitis outbreak happens. But the other thing that did not happen is that those toilets that should have been placed, right, in those 5 long years were still nowhere to be found, and it was still out of service. We also looked, when we look at this issue of public health infrastructure, and namely, we're talking about tonight restrooms, we also know that there are legal obligations. And so a commission like these, and I think I need to list some of the legal obligations that the city is liable, could be liable of failing to honor. And so just a short list, just for your discussions. Los Angeles County Code Title 11, Health and Safety, instructs that public restrooms must be kept in good free repair and free from dirt, filth, and corrosion, be adequately supplied with running water, well ventilated and lighted. In 1928, the state constitution was amended to affirm that water should be conserved for the interests of people and public welfare. The California Public Utilities Code 1993, Section 739.8 states, an access to an adequate supply of healthy water is a basic necessity of human life. And just to be clear, when we talk about water, and water is a human right, it's not just water that we drink. It's water that we cook with, and it's also sanitation, right? And so when you hear me talk about water and the right to water, it's the right to water for all of these things. And then lastly, just for the purposes of tonight's conversation, in 2013, California enacted the Human Right to Water Act, AB 685, which statutorily recognizes that every human being has the right to safe, clean, affordable, and accessible, adequate for human consumption, cooking, and sanitary purposes. Right, and so there's a body of domestic law that we need to consider when we're thinking about the lack of public restrooms and public health infrastructure. There's also human rights law, which we won't get in tonight, but we see and we view this as a human rights issue. A couple of more things. And I brought a couple of copies, but I didn't, we're a small organization, so I didn't have enough money to provide color copies for everyone, but I have a couple of copies that I will submit. One of the other things that we noticed in other reports that highlighted the lack of restroom facilities, the places that continue to be missed, right? The place that continues to be missed most is the impact on women and families when there is a lack of public health infrastructure, and namely restrooms. And I will note, women suffer additional discrimination, often deprived of their dignity and sanitation needs, as society is yet to deem gender-specific needs important. Women's needs for restrooms is further amplified by the fact that they are oftentimes the main caretakers of dependents. Medical studies show the importance of regular urination, with women generally needing to void more frequently than men. Adverse health effects that may result from the voluntary urinary retention include increased frequency of urinary tract infection, UTIs, which could lead to more serious infections and, in rare situations, renal damage. UTIs during pregnancy have been associated with low birth weight babies who are at risk of additional health problems compared to normal weight infants. And so when we think about restrooms for poor populations, we're naming women now, but we can also name disabled folks, right? We can name seniors on medication, who need water, who need restroom facilities, right? As folks that we have to pay attention to. The last thing that I want to share is the American architects created a few maps for us based on the city's, based on the Department of Public Health's 2012 corrective action for the city of Los Angeles that said we needed one new restroom facility per 300 linear feet to serve the Skid Row community. And so they measured 300 linear feet across 50 square blocks of which is downtown Skid Row. And the number that we came up with for new restrooms is 110 restrooms that would actually allow the city to comply with the Department of Public Health's corrective action, which to date they still have not. We looked at the same map and compared it to a refugee camp, the standards for refugee camps, the international standards. And when we looked at those standards, instead of 300 linear feet, the spacing, when we measured the 50 square blocks in Skid Row, it would be 1 per 50 meters to serve the Skid Row community, meaning 382 restrooms in a 50 square block if we were indeed interested in complying with the United Nations standard for adequate restrooms. Lastly, we have a list of recommendations. So when we do community-based research, some researchers have recommendations. We call our recommendations action plans or our action agenda on how to rectify the public health the lack of public health infrastructure in downtown. Number one, in short, shift current political and governmental priorities and resources from criminalization to housing. Two, place adequate numbers of trash receptacles in Skid Row. Three, frequent trash collection. Four, immediately increase the number of restroom facilities available to residents. Five, frequently clean restrooms and ensure toilet paper, feminine products, soap, and hot water are available. Six, provide potable water sources for Skid Row residents. Seven, install hygiene centers at local parks or other accessible locations. And eight, and most importantly, develop a community health council to address issues for the long term. So I will say the city of Los Angeles has heard some of our recommendations as we continue to move toward a model of not temporary, but mobile solutions. We look at the Lava Mae trucks that were brought in from San Francisco, right? We look at the effort, and the verdict is still out on the refresh spot in downtown Los Angeles because it was open for 3 months. It was supposed to be open for like 9. It was open for 3, and it's still closed. But models of bringing in trailers, right? Looking at the public health infrastructure crisis as a health crisis. But there's a lot of work to be done, and hopefully this commission is thinking about ways of jumping in. Thank you.
Thank you very much for your presentation, and definitely learned a lot of new information just by listening to your talk. Commissioners, any questions? Commissioner Shannon?
So I agree with everything Pete White is saying. It's just outrageous what's been happening. In our last report, we recommended that the city adopt the World Health Organization standards, which was 1 toilet per 20 people who are homeless. And you see sort of where we've gotten so far. But it's outrageous. So last year, because we do our outreach at night on Skid Row, so last year the public toilet that's on San Pedro Street had a broom handle stuck in it because every time that it closed, it would lock on people. So these are just the things that folks have had to resort to just to use the bathroom. And this is before there was even talk about bringing in like mobile toilets and these hand washing centers. So I wanted to, and I do know, there is more movement, thankfully, on the council, which is never going to be enough, as we know. And I know that Jose Huizar had put in a motion, just so that people know that this is moving, to add more money for attendance, because that seems to be the thing that everyone wants to focus on. But I do know that there are I think there are three trailers now behind the Weingart Center, which are closed, but I hear that they're opening. So I'm wondering if you could comment on that and how that might impact some of what's going on there.
And so our organization worked diligently and hard on the refresh spot. That's the trailers behind the Weingart Center. And we worked for an entire year with the mayor's office. But we were very clear from the outset that 3 trailers is still not enough, right? And so when you think about the 3 trailers, there's like 10 toilets, 7 to 10 toilets, still not enough for the population. And so we see, because this is Los Angeles, we see when we apply pressure, right? When the community says we demand that these things happen, there's oftentimes a little movement, but not movement significant enough to really begin to address the problem in a very substantial way. And so for us, we participated there. We're also calling now, I'm sure this commission has heard about the money from the governor, the $160 million that's coming to Los Angeles, 80 of which is going to the county. The other 80 of which is going to the city, 20 million of which is coming to Skid Row. And so from the community's vantage point right now, we are doing our own research, we're doing our homework, and we're fighting for a substantial portion of that money to go towards public health infrastructure, namely water and restrooms. I think, though, it's imperative that this committee and others like it really lean in and say, people can't wait to go, right? We have got to bring public health infrastructure today. The other thing, Commissioner Shannon, I think that is important to note on the story that you named around people placing a broom handle, keeping the door open. The other thing that has been quite problematic has been the locking of restrooms at dusk. And so for years, that's been the tradition. We have 5, and of those 5 APTs, you know, the working rate is always crazy, but at dusk, they're all closed. And then no one has anywhere to go, and that's why you see so much urination and defecation on the streets. I will lastly say that Skid Row residents, houseless residents, have been in the practice of cleaning up the community, the Skid Row community, for decades, right? And if the city would reach across the street, metaphorically, and assist in that, I think residents could find a way out of this.
Commissioner Mandel.
Thank you, Ms. White, for being here, and thank you for your wonderful presentation. More importantly, thank you for your advocacy and all you've done in the years that you've led this organization. You mentioned that since '87 and even since 2012, more recently with the reports, clearly showing what needs to be done, that nothing gets done or very little gets done. Why do you think that is, and where do you see the resistance coming out of City Hall?
You know, and so our city, our great city, when you look on the books, when you look at on the books and when you look at the legislation, we look very, very progressive, because that is actually a testament to community organizations on the ground on all of these issues, from houselessness to housing to economic development. City leaders have been pushing, organizations have been pushing. I think, though, when we talk about public health infrastructure in Skid Row, I think the barrier that's erected is this ideal of permanency, right? If we place restrooms down, people will stay in Skid Row, people will never go anywhere. And our argument is that if we just build housing, we won't have houseless people, and we won't have to deal with the public health infrastructure. And so we find ourselves in a weird place, right? We're talking about a bridge home opening shelters. We're talking about Triple H, which, you know, was 10,000 units. That's now down to 6, right? That's now down to 6,000 units. But I believe that that energy of Angelenos outside of this horseshoe that says enough is enough is sort of what we need. That's the fuel we need to move us away from this resistance of let's just build it. Let's not build it because they shall come. I think the city of Los Angeles, we still have a lot of learning to do. I think we have to stop investing. In 2016, the CAO would report the city of Los Angeles spends $100 million in homelessness, right, in homeless service. 87 million of that 100 million went to the Los Angeles Police Department. And so we have got to reprioritize what's really important. I believe that health is important, right? I think housing as a public health intervention is the most important. I think that more people have to have this conversation, right? I think that, you know, the Department of Public Health, that's county, right? And the city of Los Angeles, you know, we pay them to come in. I think there's a conflict of interest there. I think it's commissions like these that have to say enough is enough, right? And make sure that we bring the human right to water to all Angelenos.
Thank you for your time and being here.
Thank you.
Commissioner Hisrich?
Thank you for bringing this to our attention. We did in our previous report make reference to the lack of bathrooms. There was in that report a discussion, or at least a mention, of a pit stop program that is supposed to put about $1.3 million. What's the impact of that? It doesn't tell me how many there were or what happened with them.
And so, you know, the great thing is Los Angeles goes to San Francisco, and there are great ideas.
Right, modeled on San Francisco.
It's modeled on San Francisco. But when we bring these resources, Pit Stop would work, right? First of all, we don't have a lot of public health infrastructure to allow the Pit Stop model to really work, right? So we have to build more. And for us, we don't want to build. We don't want to build brick and mortar types of solutions because, one, in the city of Los Angeles, it costs so much to build anything. But two, most importantly, it takes forever in permitting, right? And so for us, we want to bring in these mobile solutions. We want to bring in pit stops, right? But until there's the political will to place, and I'm not, you know, I'm very clear. I'm not saying that we're going to place 110 restrooms down tomorrow, right? But when I juxtapose 2012, there's a call by the Department of Public Health that says we're going to have a hepatitis outbreak if y'all don't do something. Fast forward to 2017, and we have a hepatitis outbreak. I would think that that would be enough impetus for the city to say, let's do a real Herculean effort to get something more than 3, something more than 5 on the ground. We're starting to see across the city more attempts in a disparate way of placing porta potties and other things. We have ideas about porta potties being down. We have ideas about methods of employment for houseless people in the communities that can actually serve as the pit stop employees, right, in those communities as we sort of continue towards building housing.
You know, if the World Health Organization standard was used, as Commissioner Shannon points out, 1 per 20, that'd be about 650 in the Skid Row area, which you've got more conservative estimates. But is there an inventory of what is available now? I mean, people have to go someplace. I just wondered, you know, what the inventory currently is.
And so we have that 5 to 8, I think it's 5 to 8, that's going to be at some point available at the center behind Weingart, but that too. So mind you, even at the Weingart, at the refresh spot, that site in 2.5 years, 3 years, is going to be uprooted, and they're going to build a building there. And so once again, we're again forced with this temporary, right? And so, but even if those were open, the Gladys Park park now has about 3 restrooms going in, and And then we have the 5 automatic toilets. So we have, during nighttime hours, about 14.
14 or something?
About 14, 15. During the daytime hours, when some of the service providers are open, there's a bit more access. But as we all know, people have to go 24 hours a day.
Yeah. Some of us have to, well, never mind.
I think I noted that in the report, yeah. Some of us have to go a bit more than others.
Absolutely.
I'm reaching that age.
Commissioner Shannon, did you have another comment?
Yeah. So I would invite people to go out to Skid Row at night. That's usually when I take people out there. So I was out there Friday with Senator Henry Stern and our volunteers. And basically what you see at night is a little different than what you see in the daytime. First of all, there's trash everywhere. That's all the time. And that's because the city has pretty much refused to put more trash cans out there because they don't want to pick them up and they don't want to pay for the services. So it's a health hazard just there. Then there are rats that come out like around 10 o'clock at night and they run around. I mean, literally, we had a state senator like shooing rats away from our volunteers because they were just coming out, and they come into the gutters. And then you have people, like what Pete White said, who are like sweeping the trash into the gutter so that at least the rats are running in the gutter and they're not like, even though they are pulling on people and trying to bite them, at least they're not like around people who are trying to sleep. One night I was out there, and literally this guy is telling me that he needs a new tent because he has holes all over his tent. And we're watching these rats come down from the tree and run into his tent. Okay, this is what we're talking about. And so, I mean, I know that we're talking about bathrooms, but you have to understand this is a public health issue that is going on where people are forced to live on the street because there isn't enough housing and we're not building enough housing. But on top of it, why can't we get trash cans? Why do people have to, sweep the garbage into the gutter? Why do we have so many rats? This is just like, I mean, I'm surprised there hasn't been something, in the last 10 years, there hasn't been some huge outbreak, but it's coming. It is coming. And if this health commission, I just think has, the ability, I think, to basically tell the city council that the time has come. The time was a long time ago, but it's come now. And we can't just hyper-focus on bathrooms. It needs to be bathrooms, and it needs to be trash cans, and it needs to be dealing with the rat situation there. It's a nightmare, and you really have to go out at night to really understand what's happening. Because I know there's like these little tours that people that will go by in the daytime, and they'll talk to people, which is great because we need the narrative and we need to understand what's going on. But you also need to go out at night to understand where people are sleeping and how they're forced to live on the streets. So, thank you.
Thank you. I mean, the dirty divide, I try to be as disciplined as possible, and I know we were supposed to be here talking about restrooms, but there's no way that you can't talk about trash. There's no way you can't talk about vermin. It's interesting, in the 2012 report, when the Department of Public Health came out, they noticed 88 active boroughs, and mind you, they didn't survey the entire Skid Row. That was like 88 active boroughs within a 10 square block area. And then when they came back a year later, after the city said that it would, in fact, try to control the pests, they saw a twofold increase on vermin. Just on vermin, I would have the commission consider. In New York, they're using dry ice, right? I would have you Google dry ice. They're using dry ice as a humane way of dealing with their vermin, right? And it's one of those things that the city could do today, right? We have to abate those issues. The co-author on this report is sitting back here, Monique Noel, out of the United Nations. She would quip, because she's been across the globe, this is a disaster waiting to happen, right? How is it that, as you noted, we haven't had 3 or 4 different types of outbreaks to date? And if the 2012 DPH findings is any guide, and if the 2017 hepatitis outbreak informs us of anything, we had better do more than a dose of prevention right now.
Other comments? I'm actually interested in the 2012 report. Is it online?
It is online. What I will do, I will share copies with you, Council President, and links, and then you could pass those out. Or you could go to www.cangres.org, CANGRESS.org, and we'll have copies of the Dirty Divide 2012 and the Dirty Divide Update 2017 out of service. I actually think in the 2012 report, we actually place the DPH findings inside of that report, so you can get their letters and stuff to the city.
If you give it to the city clerk, or get it to the city clerk, she can send it to all of us, and also we could potentially put it on our website too.
Yes.
I will do that. Perfect.
Perfect.
Thank you.
Any other questions? Thank you, Mr. White. Concerns regarding this issue? So it sounds like we have some work to do. Yes. Okay.
And let me just say, we're here as a resource for you, right? We're here to work with you on this stuff, and so use us as that resource. I put it plural because I think we need some plurality on this issue as you move forward in your conversations.
Perfect. Thank you again.
Thank you guys for having us.
Moving on to item number 2, update on Health Commission report and next steps by Matt Crane, our Health Commission intern and USC student. As he comes up to prepare, we can take public comment on item 2. Adam Cohen.
My name is Adam Cohen. I am the Director of Advocacy and Policy Research for AIDS Healthcare Foundation. I had a chance to very briefly look over the first draft of the Commission report. I think it's looking good. I'm hoping that because it is still in a draft that other items will be addressed, such as sexually transmitted infections in Los Angeles, including HIV. I think that Los Angeles, although the report has not come out for 2017 by the Centers for Disease Control and Prevention, I believe that Los Angeles will very likely be number 1 again for new cases of chlamydia, gonorrhea, and probably syphilis, primary and secondary in this case. I also think that addressing issues of antibiotic resistance is of serious concern, both in the public health and medical community, because if something like gonorrhea becomes untreatable, it's going to reach the level of HIV, in which we are just dealing with treatment and not curing. I also just want to ensure that for the discussions about homeless healthcare services, which are, again, I look forward to reading the report, but it looked like it was pretty substantial. I think it's fantastic. Definitely need to include aspects of the other social determinants of health surrounding that, such as making sure that people who are living with HIV, who receive better services such as housing, low-income housing, have better outcomes, health outcomes surrounding adherence to their medication, which then prevents further transmission of HIV. But I do look forward to this time around, this report being presented to the LA City Council as per the requirements of the Health Commission, and making sure that your voices are heard far and loud, because, you know, not only is public health disease prevention, but health promotion as well. Thank you.
Thank you. Mickey Jackson.
Mickey Jackson with Coalition to Preserve LA Healthy Housing. I'm glad you've got your report done. That's really important. But as we're hearing today, the conditions on the street are appalling and, to any rational person, terrifying. I mean, we're playing with fire, and I watch the city, I watch the mayor, I watch the city council, I go to meetings, and it just seems like fiddling while Rome burns. I mean, I sympathize with you all. it's like everybody's, being a peacock and everybody's grooming themselves for all their future ambitions while the city burns. And listening to the previous speakers, not even having bathrooms, not even controlling rats. I mean, Charles Dickens wrote about this. They complained about this before the French Revolution. This is 2018. I don't know how forgiving people are going to be about this. So I urge you to do everything within your power. Today, I went to a press conference we held in front of 36 excellently kept up rent-stabilized units. And the proposal is to tear those down and put up 100 affordable units. Well, they're two different things, and one doesn't replace the other. And why would you tear down rent-stabilized affordable housing to put up affordable housing? It'll cost, by the time that's costed out, it'll be $1 million per net unit. That's not good. That doesn't serve the public health. It doesn't serve the public good. There's plenty of other places to put these things. It's just crazy days.
Thank you. Matt? Maybe use the middle one.
This one?
Maybe.
Is that better? All right. Did we get paper copies
Yes.
to the commissioners? Okay, awesome. So that has a few edits, including from Dr. Lewis, who's working with us at the USC Sol Price School of Public Policy. That's the newest as of today, not including the pictures and figures, just so we can discuss the content more candidly. So today we'll just kind of be reviewing what the progress is, looking towards voting on it next month for publication, and then presenting it to City Council. So as far as overall progress, the homelessness section is largely completed, and as is the healthy living section, and there should be a discussion today about whether we should include a section on the emergency medical services as there was last time. As last time it was based very largely on a presentation given by Medical Director Dr. Mark Eckstein, who hasn't given a presentation recently. So there's a question of whether the commission has the authority or information to speak on that, or if we could have another speaker come in, or any kind of outside interview that could be arranged based on other connections that might be available to us. So as I mentioned, the timeline, preferably we'd like to vote on it on September 10th so that we can get this out and distributed and start looking towards next year and learn from this presentation about what speakers should be lined up to give us the authority to comment on different health issues in the city. As I mentioned, we added an additional author, Dr. Lavana B. Lewis. She is with the USC Price School of Public Policy. She's a health policy and healthcare expert, dealing especially with the needs of underrepresented groups. She's been published in the American Journal of Public Health and Journal of General Internal Medicine. And she is really a great resource for us in this area, providing not only the expertise, but also knowledge of what makes it a more persuasive argument and how we can deliver that best. But as I mentioned, we have a need to evaluate what these different policy recommendations are and what the priorities of this report should be, because the last report was much more of a landmark, kind of establishing this is the commission, and this report is more of what are future reports going to look like. So with the homelessness section, we're not going to dive through all the policy recommendations, as those have been distributed over email, and most of those have been handled in one-on-one conversations, unless any commissioner would like to specifically address one of those. But also distributed should have been an update to the, do we know, did that also get distributed, the other document? From the Board of Public Works, digitally?
Was it the bathroom?
Yeah. Okay, we will distribute that as soon as possible. But we briefly mentioned the last speaker about the Pit Stop pilot program, and actually since last month when we presented the initial draft of the report. There's been an update on July 23rd from the Board of Public Works and the Office of the City Administrative Officer that updates what has happened with that pilot program since it was introduced. And at the moment, there are 8 locations in operation, 3 of them with attendants placed at automatic public toilets. These stations also have sharps collection. They've collected about 3,000 needles in 2 months of operation. And they see a major increase in the use of these different automatic public toilets. And we'll get that out as soon as possible so that can be reviewed and kind of provide input into our bathroom recommendations. It still is far short of the 1 per 20 people recommended by the World Health Organization. So our current recommendations with bathrooms emphasize permanent and accessible 24/7 locations instead of, as mentioned before, providing mobile and temporary fixes to this issue. Additionally, the food insecurity and assistance section will need to be edited in the next month pending federal changes with the Farm Bill and the 2019 budget proposal. And it might be prudent to discuss Costa Hawkins and the November 2018 ballot and whether the commission wants to comment on that as a matter of public health for repeal. Because the previous report mentioned it as a significant factor, and it's something that's worthy of debate and possibly providing our input on that. And yes, let's see. The veteran homelessness section was added since last time, and Measure H and Proposition HHH funding has gone towards that, and we've seen a decrease in veteran homelessness. The major program that we currently recommend expansion of is Safe Parking LA, which is providing access to a washing station and portable bathroom and parking spaces for homeless veterans, providing a safe place to sleep at night and somewhere that they can refresh, alleviating some of the issues that they encounter with homelessness. We also added the heroin and other opioids section, really touching on naloxone distribution to police officers in LA County. Currently, it's been distributed to many. I don't know if it's actually all, but Los Angeles County Sheriff Jim McDonnell has led efforts. We've gotten about 6,200 doses out so far, but also exploring options to have it on hand in community centers and high-risk populations. Moreover, as discussed by Mr. Adam Cohen, the healthy living section, we plan to add an STD/STI section so that we can comment on that, as it wasn't commented on in the previous report. And we'll certainly look into the issue of antibiotic resistance as well. Yeah.
Commissioner Shannon?
So I feel like to some extent that the recommendations that we're making here are sort of watered down versions of what we had in the last report. For instance, we actually recommended that the city adopt the WHO standards for 1 in 20 people who are without housing. And so I kind of feel like we're sort of going back and watering down a little bit on what we've already done. But when you said that this has been, because this is the first time that I'm looking at a lot of these policy recommendations, so when you say it's been through emails and one-on-one conversations, who have you been having emails and one-on-one conversations? Because obviously I would have liked to have. Okay, so I didn't get any emails or one-on-one conversations, but I would have liked to have looked at the homeless section in particular for recommendations. Also, on the housing for health section, so our recommendation actually to the city council was that they supplement funding for this particular program, because it's not just a county program, it's a C3 program. So it's supposed to be county, city, and community. And so at the time when we did our last report, the only money that was coming into that program from the city was $100,000 that had come from discretionary funds from Councilmember Jose Huizar's office. And so we wanted to see an expansion of that, because it's really the county's Housing First program, and it's the program that's actually really working. I mean, I had a client who went from sleeping in his car straight into housing with keys. It's working. I have another client who's getting housing in the next 2 weeks who's coming from a recuperative center. It's working, and it's a great program, and it's helping the city, and it's helping us save money. So our recommendation last time had been that we provide financial resources. And so I'm just concerned about the way the language, the way that it reads, and some of the language, which just says, like, continue to build off the success of Housing for Health. That's great. Through financial means, which doesn't say from the city, right? And engagement of additional community stakeholders. They have a lot of community stakeholders who are working on this program. And I don't know if you've ever been there or taken a tour, but I'm happy to set something up because they work with most all of the stakeholders who are in the areas. In each spa, there's like specific community organizations that are working to make sure that people get into housing. The issue, I think, really is funding and expansion at this point. So I'd love to see that in there.
Yeah.
And then also it says, examine the HFH program through government-funded cooperative research studies, evaluating overall efficacy. So they do also have a report. I know that when we did our last report, Housing for Health had issued how many people they had helped, how they do this, what the efficacy was. So they're probably already doing that, I guess is my point. I know that there was one report, I don't want to say that it's continual, but my belief is that it is because they have to go back for funding from the county. So they may already be doing that. So I don't know I don't want to send a signal that
Sure.
they're not already doing that, so that would be because I work very, very closely with that program. So those would be the two things that I would be concerned about in that particular section.
Okay.
And then also when it says expand the flexible housing subsidy pool through county funds, the county's pretty much funding this. The problem is that the city, as part of that C3 program, is not.
Okay.
And so we want to, I think we should be, because we're making our recommendations to the city council, we want to make sure that those recommendations are very clear that the city has not been putting in, but they have been reaping the benefits of that, because for every person that gets put into permanent supportive housing, we save $25,000 to $35,000 annually per person. So I want to just make sure that we're sending the right signals to the city, that we're not just looking for a report, that we're actually looking for them to start kicking in money.
Sure.
Because the more that we expand it, the more we're going to save.
Yeah. Was this, so have you not been receiving the emails at all about the drafts from Candy?
Not for feedback. I didn't receive anything based on regarding feedback.
Okay. 'Cause
All the emails that you sent me, I go ahead and send to all the commissioners,
Yeah, I didn't
to
get anything
to
on
all of them.
feedback.
So I have my,
Yeah,
on
because
my
I
emails
have
are
very specific ideas,
Okay.
obviously, particularly regarding homelessness.
Sure.
So,
So I'm happy to just send you an email, just
right, that was going to be
through
my
this
recommendation.
and delineating that.
Okay.
Okay.
Absolutely.
So Commissioner Shannon, please work with him on those specific recommendations so we can have those. Thank you.
Yeah, first of all, I think the draft is superb, and I applaud the effort you've put in so far. And the emails that you sent out to all of us did ask for input and for our review of the draft. So I think it was quite apparent that we could all give input. A few little points. One is September 10th is the Jewish holiday of Rosh Hashanah. So I think potentially that might not be the ideal time to have our next meeting, but I'll leave it up to the chair and the president. Second thing is I think that we should address the emergency services somehow. And given the timeline, if it's possible, maybe we could have you go and meet with either the director or representative of the director's office to see what's been going on since his last report to us, and to see how we could assist him as well. Commissioner
Well, at
History.
some point, I have some comments on that, but go ahead and finish.
And then in regards to any of our recommendations, I think Commissioner Shannon's is correct, that I think that we can be bold. And there might be some area for us to discuss ideas where we could be bold, and there's no reason why we shouldn't be. I mean, especially if this is going to be read, that potentially we could have some impact on the way the council. We just heard a wonderful presentation on homelessness in Skid Row, at least. And I realize that homelessness is not just Skid Row, it's throughout the entire city, but clearly Skid Row is high density. And I think that Commissioner Shannon's correct in that it's totally inappropriate that there are not more bathrooms. We just had a report, and I think that we could easily discuss whether we should meet the WHO recommendations. The concept that there would be camps around the world that have been set up and developed that have 10 times or 20 times more bathrooms than the city of Los Angeles, is remarkable, and it's despicable that the city leadership has not addressed this, where we know that there can be refugee camps around the world set up in a relatively short period of time. And I think that Commissioner Shannon's correct. I think there's no reason why we shouldn't, and I would want input from the other commissioners, but I think that's the kind of thing that we should be bold and go for that. And there's several other areas or ideas that I think that we could put ourselves out there and suggest. There was a presentation about creating parklands in the city, and we talked about potentially creating a grand park over the 101 freeway and what benefits that would have to the city and downtown. Why can't we address that also? More open space, more parkland for people who are potentially living downtown. More people would want to live here, and if they were living downtown because there was a beautiful park over the 101, then potentially there'd be shorter commutes for people, and we'd have more investment in the local community, which would potentially also help bring in revenue that the city can then use to help the homeless people who are on the other side of Main Street. So I think that we could potentially discuss that kind of thing. And then lastly, Costa Harkins is a complex act, and I think that the November ballot it's going to be interesting. I think it's problematic for us to address that without having heard urban economists come here and discuss it. Personally, I've looked at the impacts, and I think that there could be tons of unintended consequences if this is passed, and I'm not sure we should make recommendations, especially because there's going to be an election that potentially is going to be influenced on this. We can wait and see what the election holds out. If it's overturned, then it'll be dealt with. If it's not overturned, then so be it. But I'm not so sure that the timeline of our draft, getting it into a report, would ever have any impact on the election, or should it, for other reasons, because we don't have the data behind the proper discussion and debate that would have to happen. It is very, very complex, and there are leading economists in this country that actually believe and have studied what has happened in Cambridge, Massachusetts, and elsewhere, that in actuality repealing such acts actually caused more problems than it would have.
I definitely think it's worthwhile to evaluate whether or not we have enough information to comment on that. And I do want to point out also with the Housing for Health that former Vice President Matt Sharp commented on the Housing for Health and said that we haven't had a presentation on that recently. He gave an email address for us to reach out to, so I'll be contacting that source and trying to get updated information regarding it. Most of the existing recommendations I do want to throw out there are based on a report by the RAND Corporation that was also emailed out a while ago, but if that didn't get to you, then we'll absolutely make sure. Yeah, so we'll make sure.
We did have a presentation on food insecurity,
Yes.
and there was a big discussion and presentation from two leading experts food issues. And I vividly remember the first speaker saying that the primary problem for food insecurity is affordability of housing.
Yep.
And it's quite apparent that if people are spending a significant percentage of their income on housing, they don't have enough money to spend on healthy food. And I think, this is maybe the largest problem the city of Los Angeles has to deal with, and it is a public health issue.
Absolutely. Commissioner Shannon and then Commissioner Hisser.
So I actually work like every day with the Housing for Health program
Yeah.
practically. So I'm happy to connect
Okay,
you with
sure.
the people who actually like are running it. And in terms of the RAND Corporation, I don't put much credence on their reports because they are the group that actually recommended that there was increased reporting for food stamps and SNAP benefits because that would pull more people off the rolls. So I would just caution, and some of those studies, I find that they are a little more on the punitive side of things as opposed to, I haven't seen this particular report, not all of them are, but I'm just saying that we've had to battle against some of the RAND Corporation's reports in the past because they've been about getting people off the rolls in more sort of punitive ways rather than being, helping people.
Definitely, yeah. No, I'd love to speak with
And
those
sometimes
contacts.
commoditizing, frankly, sometimes commoditizing the people that we're supposed to be serving.
Awesome. And I wanted to say before we got to your comment that I did try to get Dr. Eckstein here to do a follow-up, but he's a practicing physician and his hours didn't quite mesh with our time frame. At least for a couple of months, I was trying to work with him to get him back to do an update. So I'll try to work on that with him again. But Commissioner?
On the subject of emergency services, which I did communicate with
Yes.
you about, as I mentioned there, the Fire Commission, the Fire Department jealously guards their prerogative to operate the emergency medical services, and we shouldn't get into the way of that. But the interface with the community, such as the Sobering Center is referenced here, and as I mentioned, the other big issue is behavioral health. Emergency beds for folks that are 5150. One of the reasons that the Sobering Center hasn't gotten the number of clients that one might expect is that paramedics and EMTs on the fire engines are not allowed to transport anyone to any place other than an emergency room. The only ambulance that can do it is one that has a nurse practitioner on it. Currently is a developmental program. We're not going to replace all the firefighters with nurse practitioners in the near term. There is legislation floating around in Sacramento to see if paramedics and or EMTs can make 5150. That's mental danger to themselves or others. That's a determination that a law enforcement officer can make, but they're reluctant to. But a paramedic or an EMT cannot at the present time. So politically, that's going on. But while we encourage here, and I would encourage more sobering centers, notwithstanding the fact that this one may be a little underutilized, probably need to look in the Venice area and possibly in the valley. We also need to find a way to encourage hospitals or other facilities to develop mental health beds that folks can be transported. If you transport a patient to an emergency room and they have the capacity to handle 5150 patients, that's good. Right now, there's relatively few hospitals in the county that have that capacity. Big county, but it fills up quickly, and so on. So maybe encouraging additional 5150 beds, encouraging the development of more sobering centers. Actually, we don't even need to have the mental health facilities in an emergency room. There are 4 presently, and I think a 5th coming online that are operated by what's called Exodus, which is they can detain somebody for up 23 hours. They're not inpatient facilities per se, but there's one over by Big County, and there's one in the South Bay, and so on. They're trying to develop more of them. If you combine the capacity of the paramedics and EMTs to transport, if a person is otherwise not physically in a condition to require sutures or something, and they're just simply having a behavioral emergency, transport to those facilities, or if they are a serial inebriate without other physical problems, to be able to take them to the sobering center. That's an area which maybe we could encourage a bit more to get it moving. I mean, it's obviously moving on several fronts, including in Sacramento. But the rules for all of that are really set by the state and then administered at the local level by the county. And notwithstanding the fact that the letter from the AIDS Healthcare Foundation said that nobody from the commission had ever attended any county meetings, actually, I do attend all the county meetings related to the emergency medical services. So at least insofar as that's concerned, we do have some commission interaction with them. So if there's some additional work on this, if we could exchange notes or
Certainly.
something, I'd be happy to.
Commissioner Cato?
Yeah, in last year's recommendation for the sobering centers, we put the city of Los Angeles should explore supporting the expansion of sobering centers throughout all areas. And I think, if we can say continue this, because as, Commissioner Hisrich commented, this isn't a city endeavor, it's a county. And then, wherever the county decides, this is where the city could really step up to support it. The city could be helping out with outreach, because if the county wants to do things by right in the neighborhood, the neighbors, go against it, it's a setback. And so this is where, we as commissioners could be working with the city, helping with the outreach, so that this county initiative could, really get traction.
If I may just add, that's a good point, because a certain amount of NIMBYism does enter into the placement of these facilities. So city help on that.
Definitely. So I, again, would encourage everyone, if you have specific areas of expertise, because I'm hearing some people have very specific areas of expertise on some of these recommendations, please communicate that to Matt so that he can tailor some of the recommendations, and some of you have some additional information that we may not be privy to. It will be very helpful for him to tailor the report. But I do want to also, for the record, thank you again for that hard work, and we will keep chugging along, and thank you.
Thank you.
Any other comments?
Definitely, thank you. Just a question from Timeline in regards to your superb volunteer services to us. How long can you keep on working on this?
So I'll work throughout the school year.
Okay.
Yay.
Yeah. The bulk of the research of the report, I'd say, has been completed. At this point, we're mostly looking towards policy recommendations and towards tailoring that towards what the current climate is.
Though I think it'd be wonderful to have the report come out sooner, I think spending a little bit more time and having it better would be my preference. And knowing that you also have other academic responsibilities, I wouldn't want you to rush through this and/or distract yourself from other things that you should be doing for your own academic education and success. A couple weeks extra on this wouldn't be problematic.
His classes start in 2 weeks, so if any major change, if we can get it to him now, and then we could work on the revisions once his classes start.
It'll be all right. Don't worry about it.
Okay.
What's the timeline to submit? When do we want to have this? There is no timeline. Just by the end of the year.
I know we just have our responsibilities annually, right? So,
Depends on what year this is.
yeah.
Is this a 2017 report or is it a 2018 report?
Yeah, maybe we should change the date.
Yeah.
We can do that.
On another topic, but the September 10th conflict with the holiday, Holy Day, should we switch it a week later, the
Yeah.
17th?
I was thinking the 17th would probably be better. I was supposed to be out of
I'm
town
just
anyway.
looking, that doesn't appear to be any
Yeah,
religious holidays that I'm aware of.
that that may have to be an option.
2 days later, I'm leaving town, so that,
We just have to double check when Kol Nidre, which is the evening before Yom Kippur, is usually, it's about then, but we can
Okay.
easily check that.
If you can let me know.
Do you have it on your phone?
Yom Kippur is on Wednesday, the 19th,
Okay, so that means the 18th is the
night before.
night before.
That's a
Kol
Tuesday.
Nidre starts the night before. That's Sunday.
That'd be the Tuesday, the 17th. Before that, Monday, would that be all right?
Can't imagine why not.
Yeah, that's fine. We can move it. Yes. As long as the room is available or we can find a space. Okay. So we'll just switch the date to the 17th. That works. Thank you, Matt.
Thank you.
Thank you. Okay, item number 3. Update on commission vacancies. We have a public comment. Adam Cohen, please come forward.
My name is Adam Sakija-Cohen, Director of Advocacy and Policy Research for AIDS Healthcare Foundation. And I know that there's 8 folks here, and I know that we haven't had 15 in years. So I'm trying to, I was gauging with 8 out of 15 is about 53% here. I know the Trump administration has a 47% attrition rate, so you're like just above one of our darkest times. So I just want to make sure that, that the LA City Council takes this department seriously, this commission seriously, and actually fills the seats as best as possible. I'm glad that you all come here and talk about these issues, and I'm glad you found very impressive young gentlemen here to put these reports together, but I really think that this deserves more representation, folks that are kind of working on all the different types of public health issues throughout the city of Los Angeles. But I do hope that if the previous report kind of was able to get you to, let's say, complain to the LA City Council, maybe this report will get you through the door this time. And if anything, you should be pushing for more services just to do the job that you need to do and take care of the city of Los Angeles. Thank you.
Thank you. So here's the update. Commissioner Cato and I sat down and vetted and looked through some resumes. I think we talked about this at the last meeting. But we all know that per our charter and sort of how things work with the commission, any new commissioner has to be appointed by a council member. So I need to figure out how I'm going to do that, given the fact that we sort of we didn't do it the wrong way, but we did it an alternate way. Because as was mentioned before, these vacancies have been vacant for a while, so we thought it would be best to try to find candidates and see how we could work it. So I'm still working on that, and if anyone has any thoughts on that, I would greatly appreciate how best to do that. So Commissioner Shannon, you weren't here, but we had about 7 or 8 people that expressed interest in the commission. We just need to kind of figure out how to funnel them into council person's desk to get them on. So that's my next responsibility, and I hope to have an update for you all the next time we meet.
Well, I think there's currently 6 openings.
Yes.
Is that correct?
Yes,
Okay.
with Sharp gone, yes.
Yeah. So there's currently 6 openings, and we have resumes and individuals that would be wonderful additions to the commission.
Yep.
I would suggest that either the president and/or all of us sign a letter to the 6 members of the council who do not have somebody representing their district, saying that here's the names of 6 or 7 individuals that we have looked at and think would be wonderful additions to the commission. I think that there was also a letter to the city council president that came from AIDS Healthcare Foundation that we could clip on that and saying that we agree that those were what the percentages of the numbers of attendance was previously, that with this group that we currently have had excellent turnout now that we have people who are really serious about being on the commission, and we believe that the individuals whose names are being sent to you would be individuals who would also make a commitment to help the city of Los Angeles in regards to public health.
Okay, let's do that.
Can I get clarification, because it seems like there's 5 vacancies unless we lost someone from last time.
There's 5 vacancies. There were already 5 existing vacancies, and then Sharp had to resign. So then now there's actually 6.
So Matt Sharp, the Vice President of the Commission, has a job now working with the city and felt there was a conflict of interest. So he sent a letter of resignation about 10 days ago or 8 days ago.
Yeah.
Hence why he's not here today.
So I think your idea is good. Let's do that.
We don't need to vote on that, but those who would want to sign it or allow their name to be placed on it, doesn't have to be actual signature, I don't believe.
This is, I'm sorry, the letter that you're talking
To
about?
the six
to the six,
city council members who,
unappointed.
yes,
Yes.
just asking them to appoint somebody.
And here's a list of folks.
Here's a list of people that they can consider.
resumes.
And their resumes, and if they want to use those, if they want to pick someone else, fine. We're just kind of encouraging them to make their appointment.
Yeah. All right.
As per the law that they
Yeah.
voted on or their predecessors voted on.
Yep.
Do we know which council offices they are?
Yes, I have them.
Not
I don't
the
have them
numbers,
on
but
me,
the-
but I
oh,
have
okay.
an email.
Okay.
Candy sent them to me, so I know which ones.
Okay.
Other questions? I think we should go, let's do that ASAP. Moving on to item number 4, election of officers. It's that time of year. There's no public comment on that, so we don't have a comment card. So Vice President, President, Vice President, President, First Vice President, Second Vice President, and Treasurer. Those are the positions that are open for election. And if I recall correctly, we have to have
I'll nominate Nicole Vick for president for the year 2018 to 2019.
I'll second that.
I nominate our current president for an extra year.
And he seconded. Okay, are we voting? All in favor?
Wait, see if there's other
Oh,
nominations.
oh,
Just in-
sorry. Other nominations, I'm sorry.
Just to be fair.
Right. No other nominations, all in favor?
Aye.
Aye.
Any opposition or abstentions? Well,
It's unanimous.
here I am. Thank you. I will do my best. Okay, First Vice President.
I nominate Dr. Mandel.
I'll second that.
Second.
Okay, all in favor?
You should ask if there's somebody else.
Oh, I
wants to be
keep
nominated.
forgetting, I'm sorry. Anyone else?
Be fair.
Anyone else for First Vice President? Any other nominations? All in favor?
Aye.
Any opposition? Any abstentions?
It's
Okay.
unanimous on that, too.
All right. Second Vice President.
I'll nominate Matt Grimmick for second vice president.
Are there any
I'll second that.
Are there any other candidates for second Vice President? All in favor?
Aye.
Any opposition or abstentions? All right, congratulations.
Treasurer.
I'd like to nominate Howard Mandel to continue as treasurer.
Wow.
Anybody else want to be treasurer?
Any other treasurer nominations? Okay, all in favor? Aye. Any opposition? Ain't got no money. Okay, so we're done. I'm president, Commissioner Mandel is first vice president, Commissioner Grimming is second vice president, and Mandel is treasurer again. Okay, that's that. Any other, we forgot to add items for future discussion, but I think we have a lot here already with the commission vacancies, with the report, with the presentation that Pete White did, I think we have enough for next meeting to talk about.
Yeah, but, I think for future, for this year, with the homeless situation, HHS is providing funds for permanent supportive housing. But, the mayor and the council, they put up $30 million for bridge housing. And, I think that should be discussed as well during this year, because that's, I think by state, it's a 3-year lifespan for bridge housing. It's a state criteria. So, I'd like to get somebody with expert knowledge to talk about that.
Okay. Any other questions, concerns?
I'll miss the meeting of October 8th,
Oh, okay. All right.
just because I have pretty good attendance, but I'll be
Right.
out of town.
I appreciate you letting us know. Thank you. Okay, meeting is adjourned. Thank you all.